Hi, I'm here to provide you some information concerning LASIK and its risks so that you can make an informed decision concerning this elective procedure. LASIK, or laser-assisted in situ keratoconvolusives, has been around since the 1990s. It has been used to treat myopia or nearsightedness, hyperopia or farsightedness, and astigmatism. You may be a candidate for LASIK if you have nearsightedness up to -11 diopters, farsightedness up to +5 diopters, or up to 5 diopters of astigmatism. The procedure involves folding back a thin layer of corneal tissue that we call the corneal flap, using an instrument called a microkeratome or a femtosecond laser. The femtosecond laser creates the flap by producing tiny bubbles inside the cornea. Once the flap has been made, an excimer laser is used to remove a thin layer of corneal tissue. The flap is then replaced, where it eventually bonds back into place. The removal of thin layers of tissue causes the center of the cornea to flatten in the case of nearsightedness, steepen in the case of farsightedness, or become more round in the case of astigmatism. Many patients have undergone LASIK, about 700,000 procedures a year, with great results. However, we must warn that not everyone comes out of this with 20/20 vision. Around 5 to 10% will experience some sort of visual symptoms. One of the common side effects is dry eye. Up to 30% of patients will experience this in the first 3 months, but it will diminish with most resolving at the latest between 6 to 12 months. Throughout the years, your eyes may become under or overcorrected due to age. Less than 5% of patients will need glasses, contacts, or more surgeries to smooth out any symptoms. Another complication of LASIK is glare and a halo during normal vision. Even with the improvements LASIK has undergone throughout the years, around 6% will report glare, especially if they have high levels of astigmatism or correction. LASIK creates a flap within your cornea. This flap can be dislocated through trauma, or the edges can be compromised, leading to what we call epithelial ingrowth. Most patients do not have flap complications of any time, and if you experience any of these complications, immediately notify your ophthalmologist. Patients may also experience fluctuations of their vision, both during the night and day, but most people's vision should stabilize by 3 months. 1 to 2% of patients may experience longer fluctuations due to dryness or other reasons. 2 additional side effects are infection and inflammation. Infection occurs 0.02 to 1.5% of the time in patients, and inflammation, also known as Sans of Sahara, occurs 2 to 4% of the time. Infection should be treated with your physician, while Sans of Sahara or diffuse lamellar keratitis can improve over time, although it can lead to loss of visual acuity. Rare complications seen after LASIK is keratoconus. This is a weakening of the cornea, and it may require wearing hard contact lenses or corneal transplants, and it occurs in 0.04% to 0.6% of patients. Although we have covered complications here, there may be some that have not come up before, and we're still learning more as the procedure progresses. Just remember, LASIK is an elective surgery. It is completely up to you whether you would like this procedure done. The majority of patients report seeing 20/20 or 20/40 without glasses many years after the surgery. However, you should discuss all of these complications with your physician to see if you would be a good candidate. We hope this video was helpful, and thank you for your time.